We are working on Splenius capitis, and we will do it both prone and supine. I really like, you could even try side lying, but I really like doing both positions so that you get a better lay of the land of where the muscle's at, what it does, and also that you can access different parts when your client's in different positions. When we do it supine, you'll be dragging your fingers up the back, and that's a nice, I mean, it feels great to the client. But here, you can actually use your P-ball and get at the attachments. So as we talked about, it goes all the way down to T4 about here. To do cross fiber at the attachments, I'm going to use my P-ball. If you want to play around with some of the other tools that we have in the bin, you can. Shane, is this okay?
Mm-hmm. Yes.
So my P-ball is at about a 45-degree angle, and my pressure is in that same line of pressure. And I'm pressing right up against the side of the spinous processes. And what's that ligament called that runs all the way down?
Ligament nuchae.
Nuchae, yep. So I'm doing cross fiber against the lateral side of the spinous process. I'm going to go up to about C7. Any tender spots?
Yeah, like all of that.
All of them? Okay. So what then, if you get a report of a tender spot from your client, when you're doing cross fiber at the attachment, what's the protocol there?
You continue to do cross fiber.
Continue to do it for another 20, 40 seconds and then check in with them. And then up here at the mastoid process, I'm just going to use my thumb. I kind of refrain from using the P-ball on the head at all. So if I want to make sure I'm in the right spot, I could have my client gently press her head to the right. Oh yeah, easy. I feel it pop right away. Is that okay?
Mm-hmm.
And then for the muscle belly search, thank you.
You're welcome.
Just like all the other trigger point searches, we're going to start at one end and go up toward the heart. So because this muscle kind of spans away from the spine, you'll do a couple passes, probably 2 or 3. Let me know if anything's tender, Shane. And here, there are so many layers of muscles. What else am I going over when I'm doing a search here? What?
The erector spinae.
Erector spinae.
Traps.
Traps. Keep going, yeah, rhomboids. And then even deeper, you have like multifidi and rotatories. So erector spinae are the most superficial. Then traps and rhomboids. Then splenius capitis. So you aren't really accessing it just by like pushing its neighbor. You're pushing into it. You're pushing something that pushes it. Tender, you said? Right here. Okay. So there's a tender spot, and honestly, I'm not really sure if it's in splenius capitis or if it's in one of the other layers, but I'm not sure if it matters either, because I'm pressing and treating. And take a deep breath in. And then I could go back and recheck. Any difference?
A little bit, yeah.
Okay. I would probably treat a little bit longer if I weren't recording the video. And then when I get up here, I'm going to switch to my thumb. It's a little bit more comfortable for my hand. And remember, this right here is really the only place where the splenius capitis kind of pops out, and it's the most superficial. So right here is really where you'll feel it activate when you have your client move, and where you can get the most access as a massage therapist. All right, so cross fiber friction at the attachments, search the muscle belly, and then we'll come back and do supine after that. And now we will look at the Splenius Capitis working with your client supine, because clients are supine a lot. So if you remember where it attached, all the way down to like T4 on the SPs, spinous processes, all the way up to C5. So my client doesn't have to do anything. She can just relax, and because this is a nice cushy foam top, right? I'm going to push down underneath it, and with my core, not with my shoulders muscling through, but with my core, I'm going to go down to about C5. And then I'm going to cup my fingertips to make this pointy spot that I can scrape it up with. You could do one hand or both hands at the same time. So I've cupped my fingers and now I'm dragging up. And I'm not following erector spinae. I'm coming out a little bit. And then when I get past those upper traps, that's when you can start to feel the Splenius Capitis, right about here. And Shayna, press your head to the right. Great. I just did a quick little muscle test to make sure I was in the right spot, and I felt it right away. So slowly dragging up all the way to the
Mastoid process.
You got it. So you probably, just like you did when they were prone, do a couple passes. And then you'll be able to feel, as soon as you get past the traps and levator, boom, right there is Splenius Capitis. If you go too far anteriorly, you'll hit what?
SCM.
SCM. And while we are here supine, working on the neck, let's just do a scalene refresher. We talked about scalenes when we did SCM. So all of this stuff in the neck triangle, the posterior triangle, of course we're not going to use a B-ball. We're also not going to use any trigger point therapy, searches, but you can, well, first of all, palpate, see if you can differentiate the scalenes from, levator scapula, from upper traps, from SCM. By having them activate, laterally flex your head to the right. Relax. Flex again. Good. So I feel the scalenes help. They can also forward flex. So this spot right here on your head, raise that toward the ceiling. Oh my goodness, yes. So what do we do for them if we can't do like a trigger point search? We're just going to do some very light glides and static holds. And they come all the way up to the transverse processes. If you want to do some light circular friction, that's fine. This is like a level 2 pressure. So when you go back to your client, do Splenius Capitis from the supine position, and then check out your bony landmarks and the bellies of the scalenes.